Hey everyone, today I want to break down a device you've definitely seen in hospitals, maybe even used yourself during clinical practice, the humble pulse oximeter. So what exactly is a pulse oximeter? In simple terms, it's a small, non-invasive gadget that clips onto your finger and instantly tells you just how much oxygen your blood is carrying. Imagine that, you get a real-time readout of your oxygen saturation and heart rate, all from a little device. Why is this so important? Well, oxygen is life. Monitoring those levels is absolutely crucial when you're caring for patients in operating rooms, ICUs, hospital wards, recovery rooms, basically anywhere someone's health might be on the line. It's also essential during transfers of critically ill patients, when things can change fast and you need to be on top of those vitals. Let's talk about how you actually use one. Most commonly, you'll see the probe placed on a finger, but don't be surprised if you spot it on an earlobe or even a toe, especially in kids or patients with poor circulation. Super easy to apply and totally painless. Now here's where it gets a little sciencey, but stick with me. Inside that tiny probe are two LEDs. One shines red light and the other infrared. There's also a photodetector that checks how much light actually makes it through the tissue. Why two colors of light? Well, oxygen-rich hemoglobin or oxyhemoglobin absorbs more infrared light, while deoxygenated hemoglobin absorbs more red. The device's microprocessor crunches the numbers, compares the absorption, and gives you a readout of the oxygen saturation. That's SpO₂. Usually we want that number between 95 and 100% in healthy people. Accuracy? Pulse oximeters are pretty reliable for oxygen saturations between 70 and 100%. But, and this is a big but, there are times when you can get a false reading. For example, if the patient is in hypovolemic shock and there's not enough blood flow to the finger, or if they're wearing blue or green nail polish. Carbon monoxide poisoning also messes with the readings, since the device can't tell the difference between oxyhemoglobin and carboxyhemoglobin. And if there are certain dyes in the blood, you might get the wrong results. So, as always, don't just trust the machine. Interpret those numbers in context. Pulse oximeters are an amazing tool in your medical arsenal, but they're just one piece of the clinical puzzle. Next time you clip one on, you'll know exactly what's happening under the hood. Thanks for watching, and I'll see you in the next one.